In our previous video, we've gone over what original Medicare Part A and Part B covers. Now let's look at what it does not cover. Many people are surprised to learn that they will have out-of-pocket costs, which could be quite high depending on individual healthcare needs. Further, there is no out-of-pocket maximum, no financial protection with original Medicare. A serious illness or injury could create real financial stress. Again, if you need certain services Medicare doesn't cover, you'll have to pay for them yourself unless you have other health insurance that covers them or you have a Medicare health plan that covers them. I will talk later about ways that will help you cover whatever original Medicare doesn't cover. Another possible surprise is that original Medicare does not cover prescription drugs, which can be a big expense as we get older. Other non-covered services include routine dental, vision, and hearing care, as well as any corrective treatments, long-term care, such as in a nursing home, custodial care, which includes bathing, eating, and dressing, and may be called activities of daily living, or ADL, care received outside the United States except in certain circumstances, such as emergency care. The good news is that there are some options that may help with these non-covered items, but first, let's talk about Medicare costs. We'll start with some definitions. Most people are familiar with premiums, deductibles, and copays, which are defined on this slide. Coinsurance may be a less familiar term. It's an amount you pay when the cost of a covered service is split with you. It's determined by percentage. For example, the cost of a service is covered at 80% and you pay the remaining 20%. You may have some or all of these types of costs with Medicare, again, depending on your coverage. Here are the basic costs for Part A. There is no Part A premium for most people, as we discussed earlier, but you'll pay a deductible if you go into hospital. This covers up to 60 hospital days in one benefit period. If your stay is longer, you'll pay extra for each day over 60 up to a total of 90 days. After that, you would need to tap into the up to 60 lifetime reserve days we talked about, which will have an extra cost per day. Each year, the figures change. I will try to update the information accordingly. If you are watching a recording of this presentation, please consult with your agent or get an update on the current year costs. If you don't have an agent, feel free to reach out and we can provide this information with no obligation. Let's look at an example to see how Part A costs might play out. Let's say that this is John. John has 2 hospitalizations in 2 separate benefit periods in year 2018. He pays a deductible of $1,340 for the first stay and the same amount again for the second stay. As in aside, if John had been readmitted less than 60 days after his first discharge, the second stay would occur within the first benefit period and he would pay just one deductible. John's second stay extends past the 60-day mark covered by the deductible, so he has a per day cost for each day over 60. He stays 5 more days and the cost is $335 per day, coming to $1,675. This costs add up to a total of $4,355. John would likely be responsible for other costs too, notably a share of his doctor fees, which would be partially covered by Part B. Moving on to Part B, there is a monthly premium and an annual deductible for Part B. The costs outlined on this slide are for year 2018. It changes every year and I will try to update it accordingly, as I mentioned. Okay, so as I mentioned, there is an annual Part B deductible. After the deductible is met, you are responsible for 20% of the cost, a coinsurance, for most Part B services. You are also responsible for excess charges, if there are any. Excess charges are additional amounts that may be charged by providers who do not accept Medicare assignment. Providers who accept assignment agree to take Medicare's payment as payment in full. There is no out-of-pocket limit with original Medicare. Here's an example to help understand how Medicare assignment might affect the cost of a doctor visit. Let's say this is Maria. Maria's doctor charges $300 for a visit. The amount Medicare approves is $220. If the doctor accepts assignment, Medicare Part B pays 80% of the approved amount, or $176, and Maria is responsible for paying 20%, or $44. If the doctor doesn't accept assignment, Medicare reduces the approved amount by 15% to $209. Medicare Part B then pays 80% of the reduced amount, which is $167, and Maria is responsible for paying 20%, or $42. In addition, Maria must pay the doctor's excess charges. So the formula is 15% of the reduced amount, which comes to $31. So Maria's total cost would be $73. The dollar amounts in this example are fairly small, but the difference in Maria's cost is pretty important. Imagine what it would be for an expensive procedure. It's always a good idea to ask providers or doctors if they accept assignment before receiving services, so you're not surprised with a bill later on. So even from these simple examples, you can see that out-of-pocket costs with original Medicare can take a bite out of your budget. And we haven't really talked about the cost of prescription drugs just yet, which are not covered by original Medicare. The good news is that you have options for other coverage that may help turn that budget bite into a nibble. Now, we are going to see how Part C, Part D, and Medicare supplement insurance fit into the picture. You have basically two options for more coverage. Option 1 is to add Medicare supplement insurance and a Part D prescription drug plan to original Medicare. Or option 2 is to choose a Medicare Advantage plan, Part C. Many plans include drug coverage and additional benefits as well. Before we discuss in detail these options, I want to point out that all of three of the components shown, Medicare Supplement Insurance, Part C plans, and Part D plans, are offered by private insurance companies. What this means in part is that there are maybe a number of plans to choose from, and they may vary in coverage and costs. By contrast, the original Medicare is administered by the federal government, and benefits and costs are the same for everyone. Medicare Advantage and Part D plans are approved by Medicare and held to standards set by Medicare. These private plans options are provided to give you more choices and the ability to fill in for what isn't covered by original Medicare. We'll circle back to this graphic later. Some people with low incomes qualify for programs that reduce their Medicare-related costs. There is extra help for prescription drug coverage and some state-run savings programs that can help with copays, coinsurance, deductibles, and premiums. For those who don't qualify, paying out of pocket or buying additional insurance are their options. Feel free to reach out to us and we can go over various plans and costs that will pick up what Medicare doesn't cover, and most importantly, will set an out-of-pocket maximum that will protect you financially. In the next video, I will discuss in detail what Part C, Medicare Advantage, and Part D prescription drug plan covers. So please make sure to watch the next video for in-depth details about all these options. Thanks a lot for watching, and we'll see you in the next video.